Awesome. Well, I guess we'll just go ahead and get started. So I want to start off by thanking each and every one of you for being here today. I'm Tabitha Turner. I'm one of the analysts for the Atlanta Dream. And I just want to say welcome to the Atlanta Dream's Anthem Mental Health Panel. And I want to start off by making introductions. So we'll start off with one of the players, Elizabeth Williams, who plays for the Atlanta Dream. We've got Pam Stahl, the Georgia president for Anthem Blue Cross Blue Shield. Dr. Sharma, who's a therapist. And we also have Monique Billings. She'll be joining back in a minute. But my first question, I want to start with Mrs. Pam Stahl here. Pam, why is Blue Cross Blue Shield just so dedicated to behavioral health and mental illness?
Well, we believe mental health is health. Physical and mental health are linked and must be addressed equally for overall whole person health. And global events like COVID-19 have historically had a significant long-term impact on mental health and suicide rates increasing after traumatic events. In 2020 alone, reports of anxiety and depression increased to 42%. We don't hesitate to help individuals get the COVID-19 vaccine to protect themselves from the virus, and we shouldn't hesitate to help people find the mental health services they need as they cope with the pandemic. Both are equally important to their overall health.
So when you do start feeling a little bit overwhelmed, because you wear so many hats, I mean, you're a mother, you're president of Anthem Blue Cross Blue Shield, a businesswoman, when these moments start to arise, how do you handle, the anxiety that starts to come up with those situations?
Well, shoot, I'd love to hear from others as well. I think we're all striving to kind of keep things together, right? Not only during this time, but in just the normal course of our lives. I find, you know what, I don't know that I have any real big answer other than to say I look for some of the simple things, like certainly at this time getting up out of my chair. Some of us spend a lot of time, maybe not the dream players so much, but people like me can spend a lot of time in my chair staring at the computer working during the day. So just getting up out of my chair, getting some exercise, taking my dog for a walk, giving my dog a little pet or a kiss, going outside for a little bit and breathing some fresh air, and then certainly focusing on eating well and getting good sleep. I mean, those are the basics, and those make a difference for me.
When it comes to I'm sorry.
I'll piggyback off what Pam was saying about just little things. It's, for me, just about knowing yourself, things that make you feel like the highest version of yourself. So if kissing your dog makes you feel good and makes you feel happy and light, then do that. For me, it's also being outside, being in nature, eating good food, FaceTiming friends, just little simple things that just make you feel like the best version of you.
And Monique, I'm happy that you jumped in because I wanted to go to you and Liz next. The first half of my question to you guys is, do you believe there's a connection with mental health and the ability to, the pressure to perform on the court? And if there is a connection, what are some of the things that you face as athletes? Maybe not personally, but as athletes, some of the common denominators that you guys face on the court and off the court?
Yeah, there's totally a link. When you're not playing well, that messes with your mental health. And when you are playing well, it adds positively to your mental health. So I would definitely say there is a link, but it's all about finding balance. For me, I've had to discover that my value comes from who I am, not what I do. So trying as much to separate the fact that I am a basketball player and maybe the result didn't go how I wanted, but that's Monique, the basketball player. Monique, the human being, she's a totally different person. So being able to separate the two as much as I can, it is hard, and it is a practice that I have to work at every single day, but that's how I try to keep the balance between mental health and the pressure to perform.
Liz?
Yeah, I would 100% agree. I think a lot of times life can kind of get in the way of sports. We're humans first before we're athletes. So whether we have something going on with our family, our friends, our relationships, sometimes that can affect how you play. So it's like Mo was saying, being able to separate the two, but also be true to yourself and acknowledge like, hey, there is something else going on.
And Dr. Sharma, I wanted to go to you next because when someone I'll start off with this. Naomi Osaka, she's been all over the news lately because she pulled out of the French Open, and before that she pulled out of Wimbledon for mental health reasons with handling the press. As we're listening to some of the ways that our players cope with, anxiety and things of that sort, What are some of the signs that someone may be struggling with anxiety or depression or some kind of mental health struggle?
It's really related to a lot of fear and worry that they have, really. And the goal is really to understand what's causing it for them. And feelings of fear, anger, sadness, those are the kind of things that they're feeling. And sometimes it's frustration. I mean, Naomi's a high caliber athlete. The part that she's able to handle is the tennis. The other aspect is a whole different level of stress that she's not trained for. So that's what drives some of that change for her. She's actually doing the right thing to really take care of herself, because that's the only way she'll perform the higher level. I'm sure whenever anybody feels challenges in mental health or behavioral health, things change for them, as the panel's already kind of mentioned. Changes for their activities, their appetite, their energy, all those make a difference. Even sleep patterns, sometimes we sleep more, sometimes we sleep less, sometimes we just can't get the energy to even get out of bed. So it kind of makes other things really worse for us. Unfortunately, some folks do wind up using alcohol or other substances to help cope, to make them numb from all the feelings of anxiety or fear that they're really having.
And so piggybacking off of that, I know when people say, okay, you're just kind of stressed out, and we kind of say that saying as just something where, oh, I'm just stressed out today. So what we're kind of piggybacking and saying right now is that's something that we need to pay attention to, instead of just writing it off as just, oh, I'm just stressed out for the day.
No, it's exactly. So again, there's stress, and there's all these things that are occurring with us right now. I mean, this past, I'm going to call it a year and a half, has been really stressful for a lot of people. The pandemic, the social injustices, the elections, the economy, they've all impacted us negatively for the past year and a half. And normally you would actually see increased use of mental health where people seeking it, but we're just not kind of seeing it. So what's concerning to me is there's an opportunity for people to really get the care they need, but they're not getting it. Maybe they're not identifying the need for it, or as you just also mentioned, it's a part of life. You should be able to handle it. That old mindset, unfortunately, still persists, where as a family doc, I consider this no different than diabetes or hypertension. People need this care. They just don't realize they need to seek that care.
And so, Dr. Sharma, I want to stay with you on that one, because it's one of those things where why aren't people reaching out? Could it be social media? Does that play a factor? Does, the stereotypes and stigmas that's associated with medication? Why aren't people reaching out more often, and how can we start to get people more involved in asking for help?
It's the stigma. I mean, no one hesitates to go to the doctor when they're having pain. No one hesitates to say, my arm hurts or I'm bleeding, but they don't see the same difference, the same thing here. It's really an opportunity for them to understand mental health presents differently. Everyone's visualized someone that's having a mental breakdown by seeing someone that's going to a hospital is disheveled or that way. But in reality, we all have mental health challenges, and it doesn't matter what your background really is, but we all experience it. So for those that are needing the help, they really should be seeing a psychologist, psychiatrist, counselor, or therapist. That's the opportunity. That's someone that can really help you. And because of the stigma, if that doesn't work for them, again, because of 2020, we're living in a new world of getting care within the home. Telemedicine, telepsych, it's an opportunity. Also, for the younger population, there are apps out there that they can use. It could be mindfulness or even a meditation app. There's also chatbots out there that can really meet the member, the patient, at where they want to be. It's just a unique way for them to connect in a way that makes sense for them.
Going back to the players, Liz and Monique, and Liz, we can start with you. We heard Dr. Sharma just mention therapists for, the athletes, or seeing a therapist. do you think that every team and every league should at least have a therapist on call for their players to talk to whenever you guys feel like you have anxiety or depression or some other mental crisis going on?
Yeah, I absolutely think that every team and every league should have access to a therapist, a sports psychologist. It's like what I was touching on earlier, you know, we're people first. And a lot of us, when we're in the spotlight, that's really heavy. And so having access to sports psychologists and to therapists can be a game changer. We're really fortunate with the Dream to have somebody like that. And we've had that for a while now, which isn't always the case. And I know for me that's been really important and has impacted me really positively. And so I know for other players in other leagues, I can make a difference as well.
Mo?
Yeah, he said everything that I was thinking. And it's all about resources. The fact that we have these resources, it's nice to be able to utilize them. And I think about women who, you know, we're celebrating the 25th anniversary of the WNBA 25 years ago. I don't know if they had those resources. I don't know if people really cared about mental health. And if those women were struggling, which I'm sure they were in many different aspects, they probably didn't have those outlets and didn't have those resources. So the fact that we do is a blessing, and it's nice to be able to take advantage of them as much as we can.
And Pam, we talked about resources. My Blue Cross Blue Shield is also my insurance provider. And there's something that I go to, and it's, you know, the counseling resources. So in addition to those counseling resources that you all have, for those of us who aren't doctors and specialize in that type of thing, what else can we do to get help when it comes to our insurance providers and other things of that sort?
Yeah, so I would say, you know, whoever your insurer is, hopefully it's Anthem Blue Cross and Blue Shield, but don't hesitate to look on the back of your ID card and call a phone number there. We've got people there eager and willing to take your call and help you get connected to resources, whether they be providers that are in your network, whether it be connecting you to telepsych or telehealth resources that you can take advantage of in your home, or other, quite frankly, other community resources that are available to you. And all insurers have access to those resources. In addition, you know, I just say, look, we need to look out for each other, look out for each other's mental health and well-being, just like we do for physical health conditions. And now more than ever, we all need to learn how to cope. Things we've talked about already, start taking care of our bodies, get up and move, eat healthy, get plenty of sleep, avoid alcohol, tobacco, and other drugs, connect with others. You know, let's share your concerns with others and how you're feeling with a friend or a family member. And then finally, take breaks and practice self-care. Make time to unwind. Remind yourself that strong feelings will likely fade. Try taking deep breaths, do activities you usually enjoy. You know, this conversation here today is making me think of something. I have a connection to basketball myself. My husband's been a high school basketball coach for probably 30 years. My son played Division I basketball and spent a little time overseas as well. And one of the things that I have been so impressed with, both for my husband as a coach and my son as a player, is their focus on mental health and meditation and yoga and things that when I was a kid, we never talked about that. So I think if there's a good, something good that's come out of this last year and a half, I do believe talking about mental health is becoming more common. The opportunity to participate in panels like this and have open conversations is just so important, so that we have a space for dialogue and learn how to support each other and help each other feel that we're not alone. I think that's so important, and thank you for this opportunity.
Yeah, and thank you for being here. And I want to stay on the opportunity to address mental health issues, because we're talking about a lot of the retroactive things after the incidents have already happened, right? But recently we've seen things with a lot of the athletes like Kyrie Irving, where people throw bottles, you know, fans say things on social media, they throw bottles at these players and athletes on the court. And then there's the pressure to perform on the court as well. Carl Nassib, he just came out as gay. These are all things that can affect the athlete. So I guess basically my question is, when it comes to that, how can these players get help in the moment? What can they do to protect themselves? Because Naomi Osaka, her thing were reporters, people asking her questions in press conferences. She said she didn't want to attend the press conference. She gets fined, but she's protecting her mental health. So Dr. Sharma, what are some things that these athletes can do to protect themselves when there are moments like this where literally their livelihood is kind of pinning them up against their mental health?
It's staying connected, one, with other support that they have. Ideally, part of what they're doing is really, to be honest, is prepping for the next level of play for them. They're about to share some information that's very personal. That's not something that athletes normally have to do, but they're always asked to. It's the expectation. And is it the right thing to do? That's debatable. Because again, they bring their all to the courts, but is that what they agreed to for the other parts? Not necessarily. So it's actually working with their own life coach. I'm going to use the term life coach. We use therapists all the time, but these are life coaches also. They're helping us grow mentally to be prepared for all these things that occur, especially when we're functioning at a high level, right? That's the other opportunity for them to also connect with. Again, there's other players that have also gone through something similar to them. Those are the other connections that they really need to maintain and grow with, because again, that's someone that knows your world and can support you. Again, that support from others, it's huge, because we've all been there, and they provide the help we really need.
And I want to follow this question up to Monique and Liz, because you guys are on the court. When things like that happen, like things like what happened to Kyrie Irving happens, or when you hear Naomi Osaka pull out of Wimbledon and the French Open, how does that make you guys feel? And especially with both of you being so heavily involved with the WNBA, off the court, what are some things that you guys feel you can do or push forward to help with the mental health issues that the players have to face?
It's a tough question because it's so broad, and I feel like everyone is different how they approach their own mental health. What works for me, Dr. Sharma brought up being connected, but in order for me to connect, sometimes I need to disconnect. So sometimes I'm off social media. Like I have to take breaks from social media. I know myself. I know that if I'm in a bad space or I'm comparing myself or I had a bad game and I'm just not feeling good, sometimes I just need to get off of my phone and not be on my phone and maybe just be in stillness, be in solitude, and finding those times and spaces. And that just comes with knowing myself. I know everybody's different, but that's one thing that's worked for me. And I find that translates to the court as well, because when I feel more in my body and feel more just at home within myself, I feel like I'm able to give more to my sport and to my craft.
Yeah, I think that was really well said, Mo. And I think another thing when we hear these stories about Naomi and Kyrie and Carl, like, it's empowering for us as well. It reminds you like the power of your voice. I mean, thinking about the number of people that are impacted just by them speaking out, which wasn't comfortable for them. And then it's a reminder for me, like, hey, like, make sure you're meditating, make sure you're journaling. I'm not super outwardly emotional. So for me, sometimes it looks like taking a breath or writing things down to get myself back on track. So that's kind of how I cope with things.
And Pam, I wanted to piggyback off of Liz and Monique. Do you think it's a good thing when a lot of these players are coming out and joining in on the conversation for mental health, especially the high profile ones? Because sometimes, it can be misconstrued and mistaken as, oh, they're just joining in because it's the popular thing to do right now. Do you think it's helpful when high profile athletes jump in the conversation to kind of help along with the mental health issues?
Well, I'll add to what Monique said, it's personal, right? So I don't want to make it sound like I have an expectation that they should or should not, to be honest with you. But look, people like Liz and Monique are high profile, highly respected athletes, and they do have a platform and a voice. And if it is comfortable for them in who they are to share their point of view, others will hear. Others will listen. They do have an opportunity to have an impact. So I think I applaud them. I've got goosebumps because I'm so inspired by them taking the time to do this. And whether it be their other colleagues that play in the WNBA or in basketball or in tennis, or you know what, maybe it's that 14-year-old girl who looks up to these young ladies, who is looking for some hope and looking for some ways to cope and looking for like, what is that light? And hearing Monique say, you know what, I get off my phone sometimes. That's just too much. Turn the thing off, right? The impact that's going to have is so important. So I applaud what they're doing. I applaud what you all are doing.
And I'm really happy that you mentioned the 14-year-old girls who look up to these professional athletes, because everyone does have their own struggle. I totally agree with that, with everyone is saying, and it's personal. Dr. Sharma, you know, as a therapist, the differences that you see with how women cope with anxiety and depression versus men, you know, women have a whole nother ball game to have to deal with. You know, there's childbearing, there's everything. What are some of the differences that you've seen when it comes to men and women on the court, off the court, who struggle with anxiety, depression, and other mental health issues?
Well, let's talk about men first. Not because they're first, but their coping abilities or lack thereof. Men cope differently. They tend to want to bury their heads or drink. Believe it or not, that's the way to, quote, cope. Not the ideal way, right? Because again, the stigma for men is, for whatever reason, they believe they need to be stronger. Women, they've got everything coming at them. They're expected to be moms, be working, kids, everything's coming at them, yet the expectations, you've got to do it all. Ultimately, in order to be successful in anything you do, be it a mom, be at work, be on the court, is actually to recognize your needs. If you don't take care of yourself, everything else will suffer. So as Monique mentioned, the unplugging, it's huge. You've got to give yourself time. You know, we've talked about having a mental health day. There's a reason why. Sometimes the stress is so high, we just need to unplug. And that actually is important. Sometimes speaking to others really helps us, but sometimes we do need medications too, right? There's other things that are there, and we shouldn't hesitate to utilize them when we need them. Again, the goal is ultimately to take care of ourselves. This, again, as I've shared before, this is no different than a diabetes, high blood pressure, or anything else. Why do we treat it differently? We need to address it. It's part of everything that's occurring. So my answer is, when it comes to the athlete, because of their exposure on the courts, they may be expected to blow it off, to say you're stronger than that. In reality, everyone's human. Everyone has different backgrounds, everything that they bring to the table that brought them where they are. And they need to recognize that and also use things that work for them. You know, between Liz and Monique, they have different needs, right? But when I heard each mention theirs, to me, it was meditation. I heard meditation for both sides. It was different styles of meditation. The unplugging is meditation. Yoga is meditation. So there's different ways of getting to that.
And I want to come back to this topic with Monique and Elizabeth, but before I get back to them, Dr. Sharma, you mentioned medications, and one of my questions was, for the person that does have the stigma about medications, how would you wean them into, how do you suggest they go about the asking for medications, the dosing, what to use it with? How can you ease some of those fears for someone who's afraid to be on medication for anxiety or depression?
So what is the goal of this? It is really to treat your condition, right? There's usually not as much hesitation for other ailments, right? So why not here? These medications are support with therapy or other ways to really get you away from where you are right now, right? So a lot of times we can really feel helpless, hopeless, hapless. We don't know what to do. That's when medication may be the ideal. So for moderate to severe even depression, actually that's the best thing to do, really, to get you out of there. The idea is these medications help you with energy. They'll help you with your appetite. They'll actually, sometimes it is a mood stabilizer. And sometimes these are helping you with anxiety. Those are all things that can impact everything you're doing. And some people say, well, it's just a crutch. I don't want that. It's not meant to be a crutch. It's actually to support you to be healthy. And that's the way you should view it. And don't hesitate to ask, what's the next level for me? What can I do to make myself better? That's all that is.
And for the athletes in the room, it wouldn't be considered a PED if they were to get on. It's not like a performance enhancing drug, right? We're good on those. I had to ask. But, going back to Liz and Monique, you guys being in the spotlight, do you sometimes feel like being so vulnerable and honest is more harmful than hurtful? Is it hard to be honest when it comes to going on social media and telling your story, or going on television and telling your story? What are your feelings on that? And Liz, we can start with you.
Yeah, I mean, it's not always easy, especially for people that are more introverted like myself. I tend to keep to myself. So to be open and vulnerable, it's tough. But I think, again, it's about balance, and finding how much I want to share, how much I'm willing to share, and how comfortable I feel with that. And that's how I move forward in sharing whatever I do.
Yeah, I 100% agree with that. I am a very private person. Excuse me. I'm private, so I like to put out what I want people to know. I don't have to put out everything. And there's limits that come with that. And so, yeah, it comes back to just knowing yourself. Some people might not be as private and they want people to know everything about them. And that's totally okay, because that's their brand, but everyone has their own brand. So just knowing your brand and knowing what you're comfortable having on the internet.
And Pam, I wanted to get your feelings on this as well. I know I kind of touched on it at the beginning, but again, you wear so many hats as a mom, as a businesswoman, as a leader, how you deal with this. What are your thoughts on it when it comes to medication and the different kind of struggles that women face in today's society?
Yeah, I mean, sure, we do tend to carry it all, don't we, ladies? And I think we do it very well. I think again, some of the things we talked about, knowing yourself, trusting in yourself, knowing that it's not a weakness to ask for help. And that's some of the things Dr. Sharma was getting at. I've asked for help. It's okay to ask for help. And whether that be from your spouse or your partner or your mom, sometimes from your kids, right? Your colleagues, I think it's a sign of strength to know when to ask for help. So, I guess that's what I would leave it with. And I acknowledge again, Monique and Liz, for their courage, especially since they both shared that they tend to kind of be a little more introverted. I tend to be more introverted myself. So being on camera isn't my favorite thing in the world, but knowing where your own personal boundaries are and also having the courage to speak out about things that you care about, even doing that is so healthy for our mental health and well-being, right? It gives you that serotonin that we know we're doing something to make a difference. So I would hope that this panel and this conversation today is going to make a difference, not only for the people that hear it, but I'm going to feel great when we sign off, because I think we did a real good thing here. I think everyone will.
Yeah, I completely agree. And I just wanted to say thank you, everyone involved in today's panel. It's helped me as well. I struggle with anxiety at certain times, and being a broadcaster actually gets me back into my breathing techniques and kind of settling myself and centering myself. So I applaud you athletes, Elizabeth and Monique. I didn't make it to where you guys are, but watching you guys go out there and play and bare your souls and your feelings on and off the court is so inspiring. So again, thank you to Elizabeth, Monique, Dr. Sharma, and Pam Stahl from Blue Cross Blue Shield for attending today's panel. It was very educational.
Thank you, everybody. Thank you, Tabitha.
Thank you so much. Have a wonderful day. Go Dream.
Go Dream.